Morning, everyone. Today we are looking at brain tumor. We look at brain tumor. Our general objective is at the end of the lecture, students should be able to demonstrate an understanding about brain tumor and how it can be managed. So we look at the specific objectives. So under specific objectives, we are looking at the end of the discussion, a student nurse should be able to, one, define brain tumor, then should be able to identify factors, risk factors of brain tumor, describe types of tumor, identify the grades of tumor, state the signs and symptoms of brain tumor, and explain the management of brain tumor. So we'll begin with the definition. When you look at the definition, we are saying brain tumor is an intracranial and neoplasm, a tumor within the brain or central spinal canal. So this tumor, the growth affects the intracranial or the spinal canal. It's the central spinal canal. So now, brain tumor includes all tumors inside the cranium or in the central spinal canal. So when you talk of brain tumor, you do not say that the brain runs from the head down the spinal canal. So those, the spinal canal is a continuation from the brain. Okay, so now, we are saying these tumors, they are created by an abnormal and uncontrolled cell division, usually in the brain itself, but also in the lymphatic tissue, in blood vessels, in the cranial nerves, the brain envelope, and the meninges, the skull, pituitary gland, or pineal gland. So when you look at the brain tumor, they can, these are abnormal cells. Abnormal cells, they arise from abnormal cell division, and they affect, they can run through the lymphatic tissue, the blood vessels, the cranial nerves, the brain envelope, the meninges, skull, pituitary gland, and pineal gland. Within the brain itself, we are saying the involved cells may be neurons and glial. We are saying the neurons or glial cells may be involved, and these glial cells, these cells, we are saying, they include the astrocytes, oligodendrocytes, epidermal cells. All those may be involved. So brain tumor may also spread from cancers primarily located in other organs. When you look at the origin of brain tumors, we are saying these cancer cells, they can originate from somewhere else and spread to the brain. Okay, so the cancer may metastasize to from other parts of the body to the brain. So this is just a picture of the brain. We are looking at the brain We have the temporal lobe, we have the cerebrum, the parietal lobe, occipital lobe, cerebellum. All these are just parts of the brain, and these parts are not exemption. They can be affected by these abnormal cell division known as cancerous cells, and the spinal cord can also be affected. So let's look at the risk factor for this brain tumor. We not say that the origin of tumors is not well explained, is not known. The causes of tumors are not known, but we only have risk factors. Risk factors, these are factors that predispose one to getting cancers or the likelihood of cancers, okay? So now, a risk factor is something that may increase the chances of getting a disease. So, what are these risk factors? Some of these risk factors, we are saying they are ionizing radiations. Ionizing radiations from high dose X-ray. So, if you are frequently exposed to X-rays, then you have a greater chance of developing cancer, brain cancer, such as radiotherapy from a large machine aimed at the head. And other sources can cause cell damage that leads to tumors. Okay, then we are saying people exposed to ionizing radiation may have an increased risk of a brain tumor, such as meningioma or glioma. Meningioma, these are cancers that affect the brain, okay? The meninges and also the brain. Meningiomas and gliomas, they are cancers. Then family history is another risk factor. You find that in a family, when these cancers, the abnormal division of these cells may run in families. So it is rare for brain tumor to run in a family. We are saying it is rare for brain tumor to run in a family. Only a very small number of families have several members with the brain tumors. So yes, it may be a risk factor, but on the percentage of the family hosting these brain tumors is very slim. Hence, we are saying that it is rare for brain tumor to run in a family, and only a very small number of families have several members with a brain tumor. So those were the predisposing factors, okay, the risk factors, so to say. Then also we have, we look at the types of brain tumors. So primary brain tumor can be, it can either be benign or malignant. So benign brain tumors do not contain cancer cells. So we need to understand what is this benign and what is this malignancy. So we are saying benign brain tumors, they do not contain cancer cells. Usually benign tumors can be removed and they seldom grow back. So when this benign tumor is removed, okay, it is rare that it will grow back, okay. Benign tumors usually have an obvious border or edges. When you look at these brain tumors, the benign, we are saying that the benign tumors are encapsulated, okay? They are encapsulated and they can easily be removed. When they are removed, they cannot regenerate. Okay, so the edges of the brain tumor, you know to say that they are well marked edges. Okay, so cells from brain tumors rarely invade tissues around them. So when you also look at a benign tumor, you discover that the tissues that are surrounding this tumor are not affected, or these brain tumors, they don't invade those adjacent organs or tissues. Only where that tumor is located are the cells that are affected. So they don't spread to other parts of the body. However, benign tumors can press on sensitive areas of the brain and cause serious health problems. You look at the growth of this tumor, and we are saying that this is a benign tumor, meaning the metastasis or the growth of this tumor is not as fatal as a malignant one. So now we are saying that though not fatal, you realize that these may be pressing on other vital organ, and this may cause a problem to that organ or to which they sit on, or the cells that are affected. So you realize that they may cause serious health problems, though not fatal. Okay, itself, the tumor itself may not be fatal because it can easily be removed, but though that they may cause a serious problem. Unlike benign tumor in most other parts of the body, benign tumors, benign brain tumors are sometimes life-threatening. Okay, because you realize that where they are sitting, they are affecting or they are posing a serious health problem. Okay, so they can sometimes be life-threatening. So benign brain tumor, we are saying they may become malignant as time goes by. So you may find that it starts with a benign brain tumor, then as time goes by, it starts growing and becomes a malignant tumor. So the other type of tumor is malignant brain tumor. So we are saying malignant brain tumors, also called cancer, brain cancer, contains cancerous cells. So when you look at the malignant brain tumors, we are saying they contain cancerous cells, abnormal cells, and it being malignant, meaning the metastasis there is high. The growth of this tumor is high. So malignant brain tumors are generally more serious and often are a life-threatening, a threat to the individual's life. They are likely to grow rapidly and crowd or invade the nearby healthy brain tissue. So when you look at the malignant brain tissues, you may realize that these are growing. They affect adjacent tissues, okay? Hence, becoming easily fatal, okay? So cancer cells may break away from malignant brain tumors and spread to other parts of the brain or to the spinal cord. When you look at, we are looking at the malignant tumor itself. So we are saying that since this cancer is malignant, it has the ability to grow to other tissue, to affect other cells, okay, other tissues. And when these other cells are affected, we are saying that it becomes fatal, and when spread to other parts of the brain, it can also continue spreading to the spinal cord. They rarely spread to other parts of the body. So, because it's covered in the brain, okay, the cells that may be that are affected mostly are the brain cells. The brain cells are affected, but we are saying that on rare occasions, this malignant brain tumor can affect other body parts. Okay. So let's look. We looked at the two types of brain tumor. The brain, we are saying that the benign brain tumor and the malignant. When you looked at the malignant, the benign, we are saying the edges of this benign tumor is marked, okay, is marked and can easily be removed. Then the metastasis is very slow, though it can be fatal, okay? Now, on the part of malignant brain tumor, we are saying that this tumor grows rapidly, okay? It grows rapidly. It affects other cells, brain tissues, may be affected, but on rare occasions that this brain tumor can affect other body parts, okay? So let's look at the grading, tumor grading, okay? So physicians group brain tumors by grade. So we find that these tumors are graded. The grade of a tumor refers to the way the cells look under a microscope, and these include the following. So grade 1, we are saying that grade 1 tumor, we are saying that the tissue is benign. So all benign tumors, those benign tumors are in grade 1. So the cells look nearly like normal brain cells, and they grow very slowly. They grow slowly. So when you look at the cells, when the tumor is in grade 1, it's benign. The growth itself is very slowly. It's very slowly. Then grade 2 tumor. Grade 2 tumor, we are saying the tissue is malignant. Okay? Grade 1, it's benign. Grade 2, it's malignant. The tissue becomes malignant. The cells look less like normal cells than do the cells in grade 1. So we are saying this is progressing now. It's progressing from grade 1, it goes to grade 2. In grade 1, the cells were almost normal, okay? They were almost normal, but now in grade 2, it has just progressed a little, okay? So the cells look less like normal cells than do the cells in grade 1. Then grade 3. Grade 3, we are saying that in grade 3, we are saying that the malignant tissue has cells that look very different from normal cells. So in grade 2, the malignant cells look less like there are normal cells, okay? But in grade 3 now, the malignant tissue has cells that look very different from normal cells. You will not say that from grade 1, those were benign and cells there, they were almost normal. There was nothing abnormal about the cells apart from just slight changes when they are seen under a microscope. Then in grade 2, we said they are less like normal cells than do the cells in grade 1. Then in grade 3, the cells become, the tissues are malignant now. The cells that look very different from normal cells. The abnormal cells are actively growing. So now you realize that in grade 3, these abnormal cells, they are now active in their metastasis, in their growth in grade 3. Then grade 4, we are saying malignant tissue has cells that look most abnormal and tend to grow quickly. So the growth now increases from grade 3, grade 4, you realize that the growth of these cells becomes very fast. Cells from low-grade tumors, that's grade 1 and 2, look more normal and generally grow more slowly than cells from high-grade tumors, that's grade 3 and 4. So 3 and 4, the growth is rapid. 1 and 2, the growth is slow. Over time, a low-grade tumor may become a high-grade tumor. However, the change to a high-grade tumor happens more often among adults than children. So you find that the metastasis in adult is more fast than children. So among adults, the most common types of these tumors, we have the astrocytomas. The astrocytomas, those are the common type of cancers in adults. Astrocytomas. So what are these astrocytomas? The tumor arises from star-shaped glial cells called astrocytes. We know to say that we have glials, okay? Glial cells, these are, I would say, the neurons, okay? So these are star-shaped glial cells, and these star-shaped glial cells are known as astrocytes. And from these astrocytes, we are saying they will arise astrocytomas, okay? It can be any grade. In adult, we are saying astrocytomas may often arise in the cerebrum. So in adult, these astrocytomas will arise in the cerebrum. So these are abnormal cells and they are graded also. So we have grade 1 or grade 2 astrocytomas. So these grades, we are saying, it may be called a low-grade glioma. Grade 1 and 2, they are a low-grade gliomas. Whilst grade 3 astrocytomas is sometimes called a high-grade or anaplastic astrocytoma. So grade 3 is a low grade, or also known as anaplastic astrocytoma. Then grade 4 astrocytoma, it may be called a glioblastoma, or malignant astrocytoma glioma. Malignant astrocytic glioma. So in grade 4, it's known as the glioblastoma or malignant astrocytic glioma. Then, apart from astrocytoma, we also have meningiomas. So meningiomas arise in the meninges. So when you look at meningioma, you realize that there is meninge, then at the end there is ioma, which is a cancer. So we are saying that these cancers, meningiomas, they arise from the meninges. It can be grade 1, 2, or 3. When you look at the meningiomas, you find that it can either be grade 1 meningioma, grade 2 meningioma, or grade 3 meningioma. It is usually benign in grade 1 and grows slowly. So when it is in grade 1, as usual, it is benign and the growth rate is very slowly. But when it metastasizes to grade 2, 3, then the growth changes itself also. You realize that the growth becomes rapidly. Okay. The other type of tumor is oligodendroglioma. Oligodendroglioma. These are tumors that arise from cells that make up fatty substance that covers and protect the nerves. Okay, so you have tumors that arise from the cells that make up the fatty substance that covers the nerve. Okay, that shield. Okay, so it usually occurs in the cerebrum. We realize that they usually occur in the cerebrum. It's most common in the middle age and the adult. So these oligodendrogliomas, we are saying they are most common in middle age and also in adult. It can also be graded as grade 2 or grade 3. Among children, the most common types of brain tumor include the following. So those that we looked at are in adult. Now in children, the common ones we have is the medulloblastoma. Medulloblastoma, when you look at medulla, the brain part we have the medulla. So these cancer cells, they affect the medulla. So the tumor usually arises from the cerebellum. It's sometimes called a primitive neuroectodermal tumors. So these are primitive neuroectodermal tumors. It's grade 4 tumor. These are grade 4 tumors. So when you look at the site they affect, we are saying that it usually arises from the cerebellum, and also this is a primitive type of neuroectodermal tumor, and it's graded as grade 4. So grade 1 and 2 astrocytoma in children, this is a low-grade tumor occurring anywhere in the brain. So when you look at it in children, astrocytomas, we are saying these are low-grade tumors that may occur anywhere in the brain. So the most common astrocytoma among children is juvenile pirocytic astrocytoma, and this is graded as grade 1. It is grade 1 tumor. So as astrocytoma in children, it's grade 1 tumor, meaning it's a benign tumor. So the other type of tumor in children, we have epidymoma and epidymoma. So epidymoma, we are saying the tumor arises from cells that line the ventricles or the central canal of the spinal cord. So epidymoma, we are saying these tumors, epidymoma, we are saying these tumors arise from cells that line the ventricles or the central canal of the spinal cord. It's most common found in children and also young adults. It can be graded grade 1, grade 2, or grade 3. So epidymoma, they are graded in such grade 1, grade 2, and grade 3. Then the other type of cell, brain tumor, we have brainstem glioma, and we are saying brainstem glioma, these are tumors that occurs in the lower part of the brain. So the brainstem, when you look at the brainstem itself, this is the brainstem, okay? As it proceeds to, when you look at the pons, the medulla, we are going into the stem of the brain. And we are saying that the tumors occur in the lowest part of the brain. It can be a low-grade or high-grade tumor. So brainstem glioma, they can either be low-grade or high-grade tumor. The most common type of diffuse intrinsic is diffuse intrinsic pontine glioma. So the most common type of brainstem glioma, we have the diffused intrinsic pontine glioma. So now from there, we'll look at the symptoms, symptoms of brain tumor. Symptoms of brain tumor. So when you look at the symptoms of brain tumor, you realize that the most common symptom of brain tumor includes headache, and this usually will worsen in the morning. So when it is the morning, then this client will experience severe headache. So headache will worsen in the morning, nausea and vomiting, changes in speech, vision, or hearing, problems balancing or walking. So these are the symptoms of brain tumor. So we have a headache, which worsens in the morning, nausea and vomiting, changes in speech, vision, or hearing, depending on which side these tumors are sitting on, okay? Then there will be also problem in balancing and walking. So all this depends on where this, the abnormality of these cells are pressing on. Then changes in mood, personality, or ability to concentrate. So problem with memory, Muscle jerking or twitching, those are seizures or convulsions. Also depends on where these cells are sitting on. Then most often these symptoms are not due to a brain tumor, okay? We are saying often at the times that these symptoms are not due to the brain tumor, but other health problems could cause them. So it's not that always that when you experience such, then you say it's a brain tumor. But there can be other health problems that may be causing this problem. So how do we diagnose this brain tumor? Okay, let's look at how to diagnose brain tumor. So the diagnosis of brain tumor, one or more of the following tests can be done, okay? When you want to diagnose a brain tumor, we have neurologic exam. Neurologic exam involves checking of vision, hearing, alertness, muscle strength, coordination, and flex. So one has to perform a neurologic exam for us to diagnose a brain tumor. And in this neurologic exam, one will check for a vision, okay, to see how accurate is the vision. Then also hearing should be tested. Level of consciousness, alertness should also be checked. Muscle strength, coordination, and reflexes should be checked. Then physicians also check for eye swelling caused by a tumor pressing on the nerve that connects the eye and the brain. So we check on the swelling of the eye and also to see that these tumors, whether they are pressing on the nerve that connects the eye and the brain. Then the other test is MRI. MRI, which is a magnetic resonance imaging. So we are saying a large machine with a strong magnet linked to a computer is used to make detailed picture of areas inside the head. So this machine has a strong magnet, and this magnet is linked to a computer. And we are saying that when they are visualizing this, they'll be able to picture the brain itself, the details of the brain inside the head. Sometimes a special dye, which is known as a contrast media or contrast material, is injected into a blood vessel in the arm or hand to help show differences in the tissue of the brain. So they will inject a contrast material, a contrast media in the hand, through the veins. Then that media goes into the blood system, and a picture is shown, and this picture will tell the difference, will show us the differences in the tissues of the brain. Then the pictures can show abnormal areas such as tumors. So when you look at a contrast media injected, then visualized through MRI, and this will show an abnormal image. Then also we have a CT scan, that is computed tomograph scan. So an X-ray machine linked to a computer takes a series of detailed pictures of the head. So It's an X-ray which is connected to a computer, and a detailed picture of the head can be taken. Then the other investigation we are saying is the angiogram. Angiogram, we are saying a dye injected into the bloodstream makes blood vessels in the brain show up on an X-ray. If a tumor is present, then the X-ray may show the tumor or blood vessels that are feeding into the tumor. So, angiogram, you are still saying that a contrast media, a media is injected, a dye is injected in the bloodstream and makes the blood vessels in the brain show up on X-ray. And when these vessels are shown on the X-ray, then they will show a tumor or blood vessel that vessels that are feeding into this tumor, into these cancerous cells. Okay. Then we also have spinal tap. Spinal tap, we are saying physician may remove a sample of cerebrospinal fluid. The fluid, cerebrospinal fluid, that's the fluid that fills the space in and around the brain and spinal cord. So this procedure is performed with local anesthesia. So the physician uses a long needle, a thin needle to remove fluids from the lower part of the spinal column. So this is investigated or is analyzed through a microscope, then it will show abnormal cells. Okay. Then we have also biopsy. Biopsy, that's the removal of a tissue to look at the types of the cells. Also, when this sample or this tissue is removed, the removal is called the biopsy, and they will look at the cells, how they are, and how they grow. They will show that this is abnormal cells. These are abnormal cells. So a pathologist looks at the cells under a microscope to check for abnormal cells. A biopsy can show cancer tissues, tissue changes that may lead to cancer and other conditions. So a biopsy is the only sure way to diagnose a brain tumor. So you realize that when you remove a tissue, it's removed as a sample, taken for analysis, a pathologist will be able to determine whether these cells are normal or abnormal. And this makes a sure way for us to identify the abnormal growth of these cells. So how do we handle these brain tumors? Meaning, how do you treat brain tumor, treatment of brain tumor? So people with brain tumors have several treatment options. So when you look at the treatment option, you realize that they have a vast type of treatment. So the options may involve surgery, that's complete or partial resection of the tumor with the objective of removing as many tumor cells as possible. So in surgery, the aim is to remove those cancerous cells. Okay, so that's the first option is surgery. The second option is radiation therapy. The most commonly used treatment for brain tumor And this radiation therapy, we are saying, as it stands now, is the most commonly used. The tumor is irradiated with beta X-rays or gamma rays. Okay, so meaning these cells, cancer cells, are burned. Okay, they are exposed to X-ray, beta or gamma rays, so that these cells are burned. Then the other option is chemotherapy. Chemotherapy is a treatment option for cancer. However, it is seldom used to treat brain tumors, as the blood and brain barrier prevents the drug from reaching the cancerous cells. So you find that for this drug, chemotherapy, it is a drug used to, you are using drugs to treat these cancers. And those drugs should have the ability to cross the blood-brain barrier. So this makes it a challenge. So the blood-brain barrier may prevent the drug from reaching the cancerous cells. Chemotherapy can be thought of as a poison that prevents the growth and division of all cells in the body, including those that are cancerous. So when you look at chemotherapy, with chemotherapy, you find that they can strike whether normal cells or abnormal cells, they are all affected. And so you find that these tend to be poisonous, and both normal and abnormal cells, they tend to have a problem in development. Then many clients get a combination of treatment. So you find that when you look at the treatment of cancer, especially brain cancer, you find that clients may opt to utilize different types of treatment, different types of therapy, and sometimes a combination of therapy can be adopted. So the choice of treatment depends mainly on the following. One, you look at the type and grade of the tumor. So first thing, you look at the grade of the tumor, the type of the tumor. Is this tumor benign or is it malignant? Okay? Of course, if it's malignant, it will be difficult to operate on. But if it's benign, meaning it can easily be removed there. So you look at the grade and also the type of that brain tumor. Then also you consider the location of that brain tumor. You need to consider the location of the brain tumor and also the size, the location and also the size of the brain tumor. Then the patient's age and general health. So you need to assess even the age of the patient, and also generally, how does this patient look? Can this patient withstand chemotherapy? Can this patient withstand surgery? Can this patient withstand radiation? Those are the issues that you need to take into consideration when handling or when treating brain tumor. So let's look at rehabilitation. You know, to say that these clients, the moment, even any other cancers, the moment the patient is told that this is cancer, clients tend to be stressed. There's nothing else they think apart from death. So now you need to reassure those clients. You need to talk to those clients. So now, what do you do? Rehabilitation. Rehabilitation of a tumor patient after treatment may involve several types of therapies who can help, okay? So when you look at this, we looked at the management of these cancers and the considerations you need to put in place when managing this client. When you want to treat this client, what do you consider? So also in the rehabilitation, that is after treatment, you need to consider other options, other people around you to help you with the rehabilitation. So those that may be conducted for rehabilitation, they include the physiotherapists. Physiotherapists may be incorporated in the management of this crime. So brain tumors and their treatment may cause paralysis. And because of this, they may also cause weakness and problems with the balance. So physiotherapists help these patients regain their strength and the balance. So when you look at the physio and the clients, these physiotherapists will need to come in to educate the clients on how they can regain their balance, regain their stability. Okay. Then also to be involved as speech therapists. Speech therapists help patients who have trouble speaking, express thoughts, or swallowing. So you know to say that depending on where this cancerous cell is sitting on, the patient may present with different disabilities. So if the patient has a disability in communication, that is in producing words in speech, then you need to involve the speech therapist in that. So the other person that can be incorporated, we are saying occupation therapist. Occupation therapists should also be involved. So, you know to say that these clients may have different responsibilities, okay? So, they may be worried with their social life, they may be worried with their jobs, okay? So you need also to involve the occupational therapists to come in. So occupational therapists help patients learn to manage activities of daily living, such as eating, using the toilets, bathing and dressing. So the occupational therapist will come in. Then we also have physical medicine specialists, okay? Medical personnel with special training help patients with brain tumors stay as active as possible. So you have different cadres here who can help these clients to cope with their daily activities. They can help them recover lost abilities and return to daily activities. Okay. So we also have, we need to consider follow-up care after brain tumor treatment. So I'm almost done. I'm almost. This is the last. So follow-up care after brain tumor treatment. We are saying that the patient needs regular checkups after treatment of brain tumors. Why do you think this patient needs a regular checkup? We not say that depending on where these cancerous cells are, you realize that these patients may have different needs, different disabilities, things that they cannot do on their own. And for this reason, then we are saying that these patients needs to be followed up frequently. Okay. For example, for certain types of brain tumors, checkups may be every 3 months. So you need to schedule the time, the routine checkups for these clients. Hence, we find that those that have other patients that may have brain tumors, they may need to be followed up every 3 months. Checkups help ensure that any changes in patient's health are noted and treated if needed. So you need to look at that. If there is any abnormality, probably in speech, then you need to involve other cadres. You need to treat those ailments. If it's hypertensive, then it has to be attended to. Okay, so those are the reasons why frequent visits or checkups should be made to these patients. So this marks our end of the end of our discussion.